Welcome, and thank you for viewing an OnBoard limited release presentation for healthcare providers. This presentation will begin by detailing what each type of provider is able to do in OnBoard limited release and lead into the main focus of this presentation, which is how providers will register, access, and manage roles in the new system. OnBoard limited release will feature electronic submissions of requests for decision on unpaid medical bills, Form HP 1.0, and the listed prior authorization request or PAR types. Different provider types can submit different PAR types, and the system will enable the ability to submit various PARs depending on the provider's registration type. For example, in the first row, acupuncturists will be able to submit Form HP 1.0, non-MTGs under or equal to $1,000, and non-MTGs over $1,000. Please review this chart to ensure you are aware of what types of PARs you can or cannot submit. This chart is also available on the Medical Portal Overview webpage for healthcare providers by accessing the URL on the bottom of your screen. Registering for the Medical Portal will give you access to use OnBoard limited release when it's available. We'll now walk through who already has access, who needs to register, and how to register. If you are a provider with access to the current medical portal, you are already granted access to OnBoard limited release. When OnBoard limited release is available, you will sign into the medical portal and there will be a new link to access the dashboard for PAR and HP 1.0 submissions and review. Remember, the ny.gov ID that you use to access the medical portal is separate and apart from the ny.gov ID that you may use for other New York State agencies, such as the Department of Motor Vehicles and Tax and Finance. If you do not have access to the current medical portal, you will need to register for the medical portal to access OnBoard limited release. The medical portal page of the board's website contains a specific section for healthcare providers, which contains all registration and administration information for healthcare providers. Let's go over who should register as a healthcare provider. If your specialty is listed in the Who Can Do What chart, and you do not have access to the medical portal already, you will need to sign up for the medical portal within the Healthcare Providers section of the board's medical portal webpage. A quick reminder for dentists, audiologists, and optometrists. You do not need to be board authorized to request access to the medical portal. To sign up for the medical portal, visit wcb.ny.gov/medicalportal. Under Healthcare Providers, select Access and Administration. Next, select the Requirements section from the left column. Then you will see the Sign Up for Access to the Medical Portal button. Select this button to begin signing up. You will then enter the online registrations page. Review the information before continuing and then select the Continue button. The next page will feature two tabs, Authorization Status and Provider Information. Enter the following information required within each tab. The following information is required: registering provider type, registering provider authorization status, authorization number, which is required if you are board authorized, New York State license number, which is required if you are a New York State licensed provider, NPI, which is required for all providers, HCS ID or Health Commerce System ID. You can select No if you're unsure or you don't have one. First and last name, address, phone number, and email. After submitting your registration, it will take approximately 3 to 5 days for the board to complete the review. An email providing the ny.gov ID and temporary password will be sent to the email submitted on the registration when access is approved. Within the medical portal administration, there are a few different roles for healthcare providers. Let's define these roles. First, there is a billing delegate role within the administration pages. The user with this role will only be able to draft and submit Form HP 1.0 on behalf of the provider. If a provider uses a billing agent to submit their medical bills, the healthcare provider will need to set up user accounts for any employee of the billing agent who will be allowed to submit Form HP 1.0 on behalf of the provider. There are two types of roles, the provider role and the provider delegate role. The provider role is the actual physician, physical therapist, chiropractor, etc. The provider assigns provider delegates and billing delegates. Billing delegates can submit HP 1.0s on the provider's behalf, but only providers can submit a PAR in OnBoard limited release. The provider delegate role can draft PARs, which must be reviewed and submitted by the provider role. Provider delegates can also draft Level 2 medication PAR escalations. Delegates can draft PAR escalations for provider review and submission to Level 3 for Medical Director's Office review. The provider has to actually submit the Level 2 and Level 3 review requests. Provider delegates can respond to insurer requests for information, but must be designated to be able to do so by the healthcare provider from within OnBoard limited release. And lastly, the provider delegate can draft and submit requests for decision on unpaid medical bills, Form HP 1.0. Now that you know how to register for the medical portal and have an idea of the roles within the system, we'll detail how to administer the system. The healthcare provider is the administrator. To assign delegates, the provider administrator will start by visiting wcb.ny.gov/medical portal and selecting Administrator Login at the top of the page. Next, sign in with your medical portal username and password. And note, if you've forgotten your password, you may use the ny.gov password self-service. If you do not remember your shared secrets, you may select the email activation option to receive a password reset email associated to your medical portal account. You will start on the medical provider administration page. On the left side, there is a column which shows each option for administration. Let's start by selecting My Profile. Within the My Profile page, ensure that all information is current and up to date. If any information needs to be updated, select the Modify My Data button at the bottom. Update information as needed, and then select Continue to finish. The next option is Billing Delegates. Select Billing Delegates. The Delegates pages will show two boxes. The first box lists users who are currently a billing delegate for you and can submit HP 1.0s on your behalf. Be sure to keep this updated and remove users who should no longer submit bills on your behalf. When a user is removed, they will appear in the second box, which lists users who are not selected as a billing delegate. The Modify button will let you update information for a delegated user as needed. The second box shows a list of users who are not designated as billing delegates, but are registered in the system as a user for this provider. To designate one of these users as an active billing delegate, select the Add button in that user's row. This user will move to the first box here, and a confirmation pop-up will appear containing the changes. If someone needs to be a billing delegate but they are not in the system as a user in box 2, providers can add a new user by selecting Add New User at the bottom of this page. The new user information is then entered. Once submitted, the Add User request is sent to the board for processing. And once processed, the user will receive a user ID and temporary password via the email submitted in the form. Select Continue. The last option in the main menu is Provider Delegates. Provider delegates will be able to draft prior authorization requests, but the provider themselves is required to actually submit. This page is similar to the Billing Delegates page, with the first box showing a list of users who have a provider delegate designated to draft or submit an OnBoard limited release. Within the first box, these provider delegates can either be removed or have their information updated by using the Modify button. The second box shows users who are registered in the system that can be added as a provider delegate. To add one of these users to be a provider delegate, select the Add button. This user will then move to box 1 with a pop-up confirming the change. If there is someone who needs to become a provider delegate, but they are not an active user in the system, select the Add New User button. Enter the user information and select Continue. Once submitted, the Add User request is sent to the board for processing. And once processed, the user will receive a user ID and temporary password via the email submitted above. For full details related to registration, access, and user administration, visit wcb.ny.gov/medical portal and select the links under Healthcare Providers. For questions about the registration process, call customer service at 877-632-4996. And for technical assistance, please contact WCB Customer Support at wcb.ny.gov.